Okay, so we're still in chapter 17. We're in late adulthood, physical and cognitive development in late adulthood. Before we do the whole depressing, um, before he told me I'm quoting, before I tell you and talk about all of the depressing Alzheimer's and old people getting old stuff, I guess even though I don't know if it's physical and cognitive development so much as it is social emotional, which is probably the next chapter, right? Yeah, it is, of course. But I'll just tell you that I may have mentioned this, but I'll say it again. I've learned that there's different perspectives or different ways of being a grandparent. Now, how do I know how to be a grandparent? I am not a grandparent. I'm a parent, thank God, 6 times, but I don't have any children. Excuse me, I don't have any grandchildren. I have 6 children. So there are some bubbies, if you will, that are so excited and so happy, and they just love little children so much. Debbie, is your mom like this a little bit? They're almost jealous that you're having the kids. Not so much. They're almost jealous of the fact you're having kids, and they'll hang out with them and babysit them and spend as much time as you want with them. Okay? And then there's others who'll be like, oh wow, imagine this baby. Wow, the baby's so cute, so sweet, adorable, and then puts the baby right back into your arms. And notice, of course, those are two opposite extremes, and there's a continuum. But there's just different kinds of perspectives that grandparents take. When people get older, they're less. Now, my mother-in-law was 43, 44 when she became a grandmother, so she was definitely that first kind. Now that she's 60, she's been definitely moved over a little bit to the second kind. Okay, now I'm not saying that it's all the way over, not at all. She still loves spending time with my kids, but she'd rather go to the mall with them, hang out with them, shop with them, and whatever. But in terms of the babies, she's not really holding there anymore. She's 60 years old. That being said, there's a guy in my shul who says that he gives Zaidi lessons. He says the Zaidi can't stay on the couch. The Zaidi has to sit down on the floor and lay down on the floor and crouch down, kneel down on the floor on all fours with the kids to connect to the kids at their level. And he's right. And he's right. And from a certain perspective, I think he's right in the sense that if you want a relationship with somebody, you have to connect to them at their level. So if you're a 70-year-old grandfather or grandmother and you want a relationship with your 5-year-old grandson or granddaughter, the best way to do that is come down to their level. They're not coming up to your level. Obviously, it's easier for you to have a relationship with your 16-year-old granddaughter who you could talk to. But if you want a connection to your grandchildren, the best way to do that is come down to their level. And I think he's right about that. Okay. For the rest of today, we're going to talk about physical problems. Very, very inspiring. Essentially, I'm going to show you different videos about various problems and challenges that people have. Okay? Let me just get to my notes. Any questions before we move on? Any comments about your own grandparents, your own parents being grandparents, if they are? Excuse me. Okay, we watched the whole thing on ageism and stereotypes of aging. Sarah Winter took great exception at that lady's speech. The first two diseases I want to focus on are arthritis and diabetes. Last time Fega mentioned that if you're a runner, you're at risk for developing arthritis, I think is what she said. Something like that, I believe.
Arthritis is a term.
Hold on. She said something along those lines. And she's not really wrong. I have a grandfather who used to jump rope and he used to jog a lot, and then he basically had no cartilage left in his knee. What is cartilage in a knee? It's basically all the stuff that makes it so that the joint can move without the bones rubbing up against each other. Okay? Make sense? So the cartilage is very important. So can you use up the cartilage? I don't know. Let's see. We'll watch the video. But essentially, it's he damaged himself by jogging or by jumping rope or something like that. This is arthritis. Let's take a look. I'm going to show you a bunch of videos today. If I find them boring or you find them boring, feel free to let me know. Okay? I'm going to do my best to not bore you. I promise you.
That we hear all the time, right? But to break down this word, arthritis, itis means inflammation. Everywhere in medicine is going to refer to inflammation, and whatever before it is telling us where the inflammation is. And in this case, arthra is referring to joints. Now we have joints in our body that don't move, kind of like pieces of our skull that come together. Those are not meant to move, and it's just holding our head together. But the joints that we're thinking of, and the joints we're going to talk about, are the joints that do move: your knees, your elbows, so on and so forth. And in those joints, the rough structure pattern is always going to be we have one bone, the end of one bone, and then another bone with a space in between that is enclosed by a joint capsule, and it's lined with synovium, synovial lining, which produces a fluid that we call synovial fluid to lubricate. And on the surface of these bones, we have cartilage. So that's going to be the rough structure, and I'll draw this in much better detail later. So any kind of joint inflammation qualifies as arthritis, and there's actually a lot of different kinds. So if we ask ourselves, what is arthritis? I want to go through some of the big categories of things that qualify as arthritis and the kinds of people that are likely to get each kind. But the first category is probably the most common category, and that's going to be arthritis from overuse of the joint. This is probably what your grandma's talking about when she's saying, my knee hurts, I have arthritis. And the thing is, you and I will probably get this kind of arthritis too, if we're lucky to live long enough. So the groups of people that are most likely to get this kind are those who are elderly, because they've lived longer and have used their joints for longer, and also people who are obese and overweight, because the extra weight they're carrying just weighs down their joints. So obesity is correlated with more overuse or osteoarthritis. Speaking of which, osteoarthritis is the poster child for overuse arthritis. Osteo meaning bone, arthritis. I'm not going to write this out every time, so from now on, I'm probably going to refer to it as OA. Lots and lots of people get this, usually in the weight-bearing parts of their body or whatever is overused the most. For example, a typist might get this in her fingers or wrists, or a dancer might get it in her knees. So this is due to rubbing away of the cartilage and general wear and tear on the joint. We'll go into the specific pathophysiology later. And the second big category, and it really qualifies as a big category because it includes a lot of different diseases. This one's going to be autoimmune. So auto means self, and immune is referring to our immune system, which is usually the system that helps us fight off invasion from the environment. So essentially the body is attacking itself. And some of the famous diseases in this category you might have heard of include lupus, Crohn's disease, and they're often systemic, means they reach a lot of different parts of the body. And the population, if we had to bet on the biggest population to have these diseases, would be females, usually in middle-aged females, but for now, we're just going to say females. Of course, guys get them too, but if we're going with our odds, it's more common in female patients. So autoimmune arthritis, at the top of this list has to be rheumatoid arthritis. Rheumatoid.
There are doctors who
Aside from
specialize
OA, this
only
is
in
the other
this,
huge
in rheumatoid
category
arthritis.
of people with arthritis. Rheumatoid arthritis. And even though it's very different from OA, they're often contrasted against each other because these are the most common kinds. So when we're diagnosing, we always want to see if they're leaning towards OA or RA. So compared to OA, the patients on average might be younger. But of course, elderly people get RA as well. But as we'll see later, the symptoms look very different. There's a whole branch of medicine called rheumatology that deal with rheumatoid problems. So that kind of suggests how widespread it is. And the thing is, rheumatoid arthritis has a unique thing we can isolate from testing the patient's blood. It's called rheumatoid factor. I'm going to write RF. Rheumatoid factor is something you can test for, and it pushes you towards a diagnosis of rheumatoid arthritis. Now, I'm mentioning this because the rest of the diseases I want to list in the autoimmune section are collectively referred to as a seronegative arthritis. And this is referring to the fact that in their serum, they don't have rheumatoid factor. So this whole category is there to separate rheumatoid arthritis from the other autoimmune arthritises. I don't know if that's a word, but that's what we're going to call it. So seronegative is the first part of the word. The other half of the category refers to the fact that these diseases often involve the spine, not just the joints in our limbs that we think of. So spondylo refers to the spine. So spondyloarthritis. The name here tells you a lot. It tells you that it's not going to be RF positive, and it's going to involve the spine. So we have ankylosing spondyloarthritis. Ankylosing means a fusion, fusing.
So you guys think you could learn enough about arthritis for now? I think so, right? You're not in nursing school. You don't need to know further details on it. Obviously, there's a whole bunch of different kinds of arthritis. And the first minute was probably enough information. Okay, any questions or comments? Miss Shalia Sabu? Okay. No? We're good? You know anybody with arthritis? Or are you talking?
Yeah, I said my grandfather had that.
And how did he manage it? Try to manage it.
I had a stroke when I was born.
Mm-hmm.
So he kind of had like a decline as I got older until he passed away. So I wasn't really thinking about that. I just thought it was normal. I mean, I knew his hands were
Shaky?
not
Or,
they're actually like kind of deformed from the arthritis.
oh, wow.
So it was very hard for him in the end to like do proper things like eat and just do normal daily things. And I guess it just makes you very thankful for your hands and feet because some people are in a lot of pain.
Yeah. When you know, I just Googled, why do people's hands shake? And according to Google, healthline.com, the most common cause of shaky hands is essential tremor. It's a neurological disorder that causes frequent uncontrolled shaking, especially during movement. Other causes of shaking hands include anxiety and seizures. I know somebody that we grew up with. Some of you probably know, the family quite well. Yeah, the whole family, their hands shake. It's just like literally, like you see them like it takes them time to like put a key into a lock.
Little kids, like, or just like the adults?
No, even like the ones in their late teens. They just I don't know. I'm not a neurologist. I don't know why, but I think it's hereditary. And as a guy, my shul also has his very shaky hands. And again, I used to think it was arthritis, but I think obviously, you see, it's not necessarily that way.
I know someone who has shaky hands from anxiety, actually.
Really? Wow. That's I didn't know that, and I know
It's just when they anxiety attack more than like.
Oh, in the moment, like a panic attack kind of thing, or
like getting very, very nervous. Their anxiety is kind of like going insane.
Mm-hmm.
But they're more like high functioning anxiety than like not be able to do anything.
Right.
But if they're like really nervous, you can tell that they're having like an anxiety attack just from their hands.
Mm-hmm. Okay. Anybody else have arthritis? Just kidding. Baruch Hashem, you guys are young enough to not really have arthritis. We're going to look at a film about diabetes. But we're going to change the modality here a little bit. Be a little bit younger, just for the sake of it. Here we go. Diabetes, okay? You all know about diabetes? You know people who are diabetic? Sunday night I went to before we watched this, Sunday night I went to a rally. Was it Sunday night? I guess probably Monday night. I was a rally for Zach Plotzker. Do you guys know who Zach Plotzker is? Zach Plotzker is a guy, he's about my age, I would say, maybe 5 years younger at most, who apparently needs a kidney. And so they had this organization called Renewal. Renewal is an organization that helps from families that have a need for a kidney transplant on many different levels. They help them. And they were, they did this rally and they had like 30, 40 people. Unfortunately, the amount of people that showed up was a dud. There were only like 40, 50 people there. There should have been 1,000 people there. But almost everyone that came actually got swabbed to see if they're a match, which they said they've never gotten so many people swabbing at one event. So I actually did swab myself to see whether or not I would be a candidate for him. And even if I am, doesn't mean I'm necessarily going to go through with it, because donating a kidney, I think, is I would need to ask a shaila and look into it and whatever. Okay, and so it's not a simple thing to do. You're in the hospital for 3 days, and it's a 3-week recovery. And what if I need my other kidney when I get older?
Easy recovery.
Easy recovery?
Like no. Even bone marrow, which is like such a small amount.
Mm-hmm.
A terrible recovery.
Yeah, so it's not so simple, right? But I mean, if I could save his life, maybe, and there's no one else to do it.
A real moral dilemma.
Yeah, but I did get swabbed, and we'll see what happens.
But why did you get swabbed then? Because then you're putting yourself in that moral dilemma.
Because I want to be able to answer Hashem. That's why.
My instant reaction was, okay, I'm going to get swabbed, but then I realized I don't know
if you would do it.
Like I can't.
Yeah, look, I Baruch Hashem, I'm able to live with decisions that I make, but we'll see what happens,
And when you get swabbed, you kind of have to go into that knowing you have a very a chance.
Obviously, yeah. We'll see.
That responsibility of
I always claim to be a Baal Chesed. Now let's see if I can put my kidney where my mouth is. Yeah.
You're praying. You're like, yeah.
Okay, so we'll see. We'll see what happens. I actually had a physical this week, and I asked my doctor if there's any reason to think I'm pre-diabetic. I'm technically overweight, I mean, if you those of you have seen me in person, I don't give off the appearance. I don't think of being particularly overweight, but I am like 220 pounds. And
Yep. BMI is not so accurate, so don't take it so personally.
yeah, I'm not worried about it. And she said, there's no reason to think that you're pre-diabetic. I mean, and my blood work is good, Baruch Hashem. So,
But type 2 is adult onset, so.
I don't have any diabetes in the family. And
No, it's not genetic.
it's not genetic. Okay, in that case, sorry, you're getting me nervous. All right, let's take a look at it. Let's learn about diabetes. Here we go. I had this open. Here we go. Let's see. We'll see if this film's any good.
You are not alone. Of course they're not alone. We're right here. No, I mean, they're not alone because they have diabetes. This affects millions of people every year. Millions? Is there a cure? Unfortunately, there is no cure. But there is treatment. And after we tell you what is happening in your body, we'll show you how to take care of yourself. Look out, diabetes. Here we come. The body is made of trillions of cells. That's a million that need energy to function. Millions of millions? That's a lot. How about 7? The food you eat is turned into sugar, which is called glucose. And glucose travels to all of your cells through the bloodstream. Inside your body is an organ called the pancreas. The pancreas makes something called insulin, which helps all those cells in your body use the glucose. Your cells need the glucose to grow and get the power they need. If you have diabetes, your body has trouble controlling the level of glucose in your blood. Either your pancreas isn't making enough insulin, or your cells aren't reacting to the insulin the way they should. So there's too much glucose running around in your blood. And that's a bad thing? Yes. Having too much or too little glucose in your blood can damage your heart, blood vessels, kidneys, brain, and nerves, and cause eyesight that gets worse and worse over many years. And that's not good. How do we know if we have this? Some symptoms are too much thirst or hunger, peeing too often, weight loss, tiredness, changes in vision, slow healing cuts, and itching of your skin that goes on and on. That's a lot of stuff. That's why it's very important for people with diabetes to take care of themselves. In some cases, people with diabetes need to take daily insulin shots. Sometimes you can control this disease through diet and exercise, and taking medication by mouth. Your doctor can help you with a diet and medication plan so that your blood sugar is regulated. I know some healthy foods: fruit, vegetables, whole grains, fish, nuts, beans. And you need to exercise too. Getting good exercise really helps your body control your glucose levels. You can run, swim, skip, hop, bicycle, jump rope, play games. Just keep your body moving. Dance! But even when you're as active as Daniel, you still need to check your blood sugar level regularly. Your doctor will show you how, and in no time, you'll be able to do it yourself.
Okay. Any feedback? Anybody appreciate watching a video like that rather than a graduate level one? Much more fun, isn't it? I have a niece actually who does have what's it called? Diabetes on my wife's side. My kids and my wife went out to the American Girl doll store. Is that what it's called? American Girl? Yeah. And they actually have an American Girl doll with diabetes. And it comes with a whole kit. I think they just bought the kit, not the whole doll. Isn't that sweet? And they sent
They
it
make an
over.
American Girl doll for everything.
They're geniuses. Aren't they? Right?
I used to be obsessed with that.
Okay. All right. So diabetes, there's a lot more to talk about with diabetes. Diabetes is a terrible thing. God forbid a person even can lose their limbs because of diabetes. It's a very terrible disease. You really need to eat healthy. Everyone in our class is pretty much a healthy eater, Baruch Hashem, and you guys should continue to be healthy eaters your whole lives, even when your metabolism changes. Okay? Tehila, you want to say something? What do you want to say, Tehila?
No, I'm just saying, like in Israel, like one of my friends at some point, she was like complaining about how she couldn't see so well. And she's like, oh, I just got new contacts. Like, she's like, but everything's so blurry. And then like a week later or something, she went to the hospital and they found out that, yeah, she wasn't even like fat or anything. She was like, normal size, like tall, skinny, like very fit. But she ended up having like diabetes. And because like she was on such a like sugar high or something like that, because like it reached such a high level, she ended up like having a crash and like going to the hospital. So I'm just like, I don't know. It was just like scary to have that like in Israel where like the food is like super oily and like having to like, I remember her like measuring all her food all the time, but I was like, just being in Israel and having that is.
I thought you were going to
really
say
hard.
that the contact lenses ran backwards.
No. And then afterwards, like it went back. Like once she started like, like doing like all the shots and like measuring everything, like her vision like returned and like came back to normal.
Right.
But yeah, she would complain about it a lot and everyone was like, whatever, like maybe you're like wearing them the wrong way or like wrong prescription, but it was like diabetes in the end.
Mm-hmm. Wow, interesting. Okay, anybody else have any diabetic relatives? It's actually fascinating, and if I was giving you a shear, this would be a sheer topic. There is an issue with diabetics fasting and on Yom Kippur. So what do they do on Yom Kippur? It's a major issue. Rivka, you know people like that?
Yeah, they just, my father's diabetic. We've also had cousins in our shul who've been diabetic. They just eat a little bit. Like they have to, like, I mean, obviously they talk to like a Rav first, but they just eat a little bit on Yom Kippur, like depending on how much they need. So like just as much as they need.
Yeah, Rabbi Best sent me an article about that some expert kidney doctor, they're called, what are they called, guys? Somethingologists. Anybody know? It's slipping my mind right now. My brother-in-law's mother is a kidney doctor. There's a word for it. Nephrologist, thank you. Thank you, guys. Nephrologist. A nephrologist is a kidney doctor. From a nephrologist who what's it called? Basically designed a program leading up, I guess, to the week up to Yom Kippur to enable a diabetic to fast. Meaning, like, change. In other words, it's all scientific and it's all chemistry, right? It's body chemistry. So, I didn't actually read the article, but there's a couple people in my shul that have asked me this, Shiloh, over the years. Okay. Next. I know this is such a cheery topic, right?
Sorry, I didn't mean to scare you about the diabetes, the type 2.
I'm terrified.
Just my grandfather, he got adult onset diabetes. He was totally, if anything, he was like malnourished, my grandfather, and then he got diabetes, and that was one of the things that kind of killed him.
Wow.
You gotta be careful about your diet. It's not a joke, guys.
Okay. I have a bunch of Alzheimer's videos to show you. I want to just make sure I have the right order here. They're just kind of different aspects of it. Do you guys know anything about Alzheimer's?
Yeah.
Okay, give me a second. I'm just...
Dementia is a very...
Hold on. Okay. Let's start with this video here. Okay, Sarah, you want to say something about Alzheimer's?
It's a buildup of plaque in the brain that kind of hits areas, and people forget many things. They just forget a lot of things because it's hitting the brain and their like memory centers and then like speech centers, and even like they can't eat because they can't swallow, they'll choke. Just, it's hitting all the functions in the brain, and then they can't.
Yeah, I mean, there's all kinds of different types. Now, have you ever heard the term dementia?
Yeah.
And then you've heard the term Alzheimer's, and there's different kinds of dementia. So in your graduate level courses, when you're in the world of therapy and stuff like that, you're going to learn more about it. But for today, we're going to take a look at just some basics, and we'll learn some pretty interesting things. Okay, so let's start with this guy, Dr. Frank. What's his name? He's from Stanford. That makes him automatically pretty good. Frank Longo, MD, PhD. So he's talking about what Alzheimer's disease and dementia are. Let's take a look.
Broad term, and what dementia means is that an individual has loss of cognition in 2 or more areas of cognition in their brain. So memory and language skills, or memory plus judgment. And if the loss of those cognitive abilities is severe enough to affect day-to-day function, we call that a dementia. Now, it turns out that Alzheimer's disease is by far the most common cause of dementia, but there are many other forms of dementia. Dementia and Alzheimer loss, unfortunately, are quite common. And it is age-related. So by age 65, about 5% of people will have a dementia. By age 75, it's up to about 10% of all people will have a dementia. And by age 85, 40 or 50% of all people will have some form of dementia. The risk factors for a dementia include genetics. On the average, each of us has roughly a 5% lifetime risk of coming down with Alzheimer's disease. If you have one parent with Alzheimer's disease, your risk goes up threefold. Epidemiologic studies show that the more education that a person has, the less likely are to have a dementia. A third risk factor is head trauma. People that have had head trauma, particularly severe enough to be associated with concussion, are at higher risk for dementia. For the primary or early symptoms of a dementia, including Alzheimer's disease, most often consist of some form of memory loss, particularly with recent events. So the person will ask the same questions over and over again. They'll forget about something that had happened just an hour ago or yesterday. The remote events from early in their life are often intact initially. It's the recent events that they forget. Other examples include the loss of what we call executive function, the ability to plan and execute. So for example, if somebody was previously able to prepare a meal that had 3 or 4 parts and they're multitasking, their ability to prepare that meal will become impaired. A third early symptom could be personality change. They become withdrawn, and it's just not them. Another problem would just be lack of verbal ability or verbal output. They're no longer able to express themselves. Another problem is what we call visual spatial skills, often manifests with driving problems. They just can't visually put their environment together. Or spatial skills, they get lost in familiar places. People often want to know, are there any signs early in life that they'll come down with a dementia or Alzheimer's disease? It's one of the biggest questions in our field. On the research level, there are certain approaches to brain imaging that might predict that someone is more likely to come down with Alzheimer's. But right now, for somebody in their 20s or 30s or 40s, there's no reliable way to predict who will actually get dementia, although there are ways to know if someone's at increased risk. There are a considerable number of studies showing that exercise, physical exercise, makes a big difference. People that are physically active have about a 40 or 50% reduced likelihood of coming down with Alzheimer's and some of the related dementias. That's a huge effect. The second strategy is healthy diet. There are a number of studies out there now showing that the so-called Mediterranean diet can reduce risk by about 30 to 40%. And then a third strategy is remaining cognitively engaged, cognitively active. You'll hear the example of crosswords puzzles, but it doesn't have to be that. It's just keeping your mind engaged with something interesting in your environment. So in terms of specific treatment options, I would put those in several categories. One goes back to just the overall lifestyle, getting enough exercise, physical activity, remaining engaged cognitively with one's environment, and diet. There are currently 4 FDA-approved medications that a neurologist or other physician will work with. They can make the cognition work a little bit better and delay things by 6 or 12 months. The third area to think about if somebody does have a diagnosis of Alzheimer's is entering a clinical trial to test an experimental treatment. One exciting area is the ability to detect this disease as early as possible. One area involves brain imaging, and we're fortunate here in Stanford we have some of the leading brain imaging people in the world. A second exciting research area is looking at patterns in the blood that can detect early processes that might lead to dementia. And finally, the sort of new generation of treatments for this disorder attempts to go beyond just symptomatic treatment, but really attacking some of the underlying mechanisms that are causing the brain degeneration And there are a number of teams here at Stanford that are making great progress in that area. None of these are ready to be clinically available to patients yet, but that's our goal.
Okay. What did you learn? Debbie, what did you learn from that video? I'm putting you on the spot, but if you want to say something, you can.
Nothing. I mean, it looks like it's old. I'm like curious what they've discovered since then. Like their computers are old.
Okay.
I just think about The Notebook, like the movie.
Okay.
I watched it. Like the woman has like Alzheimer's. That I said.
I think I read the book, but I've never seen the film.
Like very famous.
Very famous. It's a romance. It's a romance, right?
Yeah.
Yeah. Okay, Esther, what did you learn from this film?
The more active you are, the less you're likely to get Alzheimer's.
Okay. Leah, how about you?
Yeah, I'm going to start exercising more.
Oh, yeah. Okay. That's a good idea. I actually just got myself a spinning bike. You guys know what a spinning bike is? And I've been doing it every day for half an hour. And it's a workout. Like a Peloton, yeah, but not a $2,000 Peloton, more of like a $450 Peloton from Costco. Okay, and actually I love it. It's a good workout. It's a good workout, and even half an hour is amazing, really amazing. So, and people swear by Peloton, right? But of course, Peloton is like, the name brand and all that kind of stuff.
If you like it,
Do I like it?
I said
Yeah.
if you like,
Oh.
if you like classes, then it's worth it.
Mm-hmm. So I don't watch classes. I watch. Ask Rivka what I watch when I'm on there. I watch baseball while I'm on there. But it
Class
doesn't.
is not the class that's instructing you what to do.
Yeah, no, I understand. But what I just do is there's something called, for exercise, there's something called intermittent, what's it called, guys? Intermittent something training.
High intensity.
Thank
You're
you.
doing
HIT, right? So how does that work? Basically, you just bring your heart rate up every minute or so. You bring your heart rate back up. Okay. So it's like if you're running, you would what I do when I run, which is not too often, but I'll jog 2 blocks, I'll sprint 1 block. I'll jog 2 blocks, I'll sprint 1 block. I'll jog 2 blocks, I'll sprint 1 block. And that way my heart rate is constantly going up. And actually, if you're trying to lose weight, that's the way to do it, as opposed to like a regular jog. Like it's better to do that for, let's say, a mile than it is to, let's say, jog 3 miles. I just made that up. I'm not saying that's totally true, but that's the concept, conceptually.
It's kind of like checkmate though, like when you get old. Like in order to not get Alzheimer's, you have to exercise and run. But if you run, you can also get arthritis, and then you have to watch what you eat, or you're gonna get diabetes. Like,
yeah. So you're darned if you do, and you're darned if you don't.
kind of.
So,
You have
yeah,
to keep
look,
your mind alive.
a healthy lifestyle is critical. The typical Ashkenazi diet is not a healthy lifestyle.
Yeah, because it's all like
Brown.
potatoes and oil, and then more oil, and then chicken and oil, and then chicken and potatoes with cabbage.
For a woman who's currently vegan right now, I'm
I
not,
don't eat anything.
okay.
No.
All right. Okay. That's step 1. It's just differentiating between dementia and Alzheimer's. Okay, they're not the same thing. They're not exactly the same thing. There are differences. Okay. Let's move on to the next video. This is also kind of differentiating between the two. It's a short video. Let's take a quick look at it, just because it's important to know this and differentiate between the two. And if you can't do that, then you're not paying attention.
We often hear about individuals with dementia and Alzheimer's disease. This is usually followed by questions such as, what is the difference? Will it happen when I get older? Don't both diseases just affect memory? By the end of this video, we will learn about both disorders and how different they actually are. First, let's look at dementia. Chances are that someone you know is affected by dementia. 1.1 million Canadians are affected either directly or indirectly by this disorder. Dementia is a term used to describe a wide range of symptoms that show a decline in mental function and ability. This makes day-to-day activities more difficult. Have you ever tried to say something and truly have been at a loss for words? Common symptoms of dementia include difficulty communicating, loss of memory, and a loss of proper judgment. It is quite common for people to contribute their forgetfulness to simply old age. Although aging is a risk factor of dementia, it is by no means a normal part of the aging process. What exactly causes dementia? Dementia occurs when brain cells in certain areas are damaged and not able to communicate with each other. This affects brain function. It's similar to broken telephone, where the message does not get across due to lack of proper communication between people, just like brain cells. The area of your brain that is responsible for your memory is the hippocampus, and cells in this area are typically what is damaged first, causing the problems with memory. Most of this damage is permanent, and the process is gradual, meaning that the disorder worsens in small increments over time. Dementia is considered an umbrella term, with various diseases grouped underneath. The most common disease classified under dementia is Alzheimer's disease. Approximately 44 million people worldwide have been diagnosed with dementia, with Alzheimer's disease making up 60 to 80% of those diagnosed. An individual can have dementia that has no link to Alzheimer's disease at all. Similar to dementia, Alzheimer's disease can cause problems with memory, but can also cause issues with thinking and behavior. In the brains of those diagnosed with Alzheimer's disease, there are protein buildups called tangles and plaques that are found in and between the cells. These disrupt cell-to-cell communication in certain brain regions, causing problems in memory and language. Although both dementia and Alzheimer's disease may cause memory loss in individuals, both disorders are vastly different in their cause and definition. Understanding the difference between the two is important to understand treatment methods, to have a better understanding of what a person may be going through, and how to help. Please visit the following website for more information: www.alzheimer.ca.
Okay. Anybody want to summarize for us the difference between Alzheimer's and dementia? Esther, go for it quickly. Kach time shalosh. No? Did she talk too fast for you? You want to watch
No, yeah, sorry, I came in late and then I just.
You want to watch it again?
No, thanks. Someone else could summarize it for me.
Rivka?
Sure. Dementia is more like a overarching like term for like memory loss and like memory decline and stuff. And then Alzheimer's is like a very specific area avenue of that.
Okay. Great. The next one is so this now I want to just touch on some of the, let me just make sure the correct order here. Hold on. Agitation, anxiety. Let's do this one. How Alzheimer's changes the brain. Okay. This one is called How Alzheimer's Changes the Brain. Please pay attention. Esther, I'm going to call on you. That is so high school. I'm not really going to call on you, but pay attention. Okay.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. people may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies. Much progress has been made in identifying various underlying factors. Advances in brain imaging allow us to see the course of plaques and tangles in the living brain. Blood and fluid biomarkers are providing insights about when the disease starts and how it progresses. More is also known about the genetic underpinnings of the disease and how they can affect particular biological pathways. These advances enable the development and testing of promising new therapies, including drugs that reduce or clear the increase of tau and amyloid proteins in the brain, therapies targeting the vascular system, glucose metabolism, and inflammation, and lifestyle interventions like exercise or diet, and behavioral approaches like social engagement that may enhance brain health. Research is moving quickly, ever closer to the day when we can delay or even prevent the devastation of dementia.
Okay. Any volunteers? I know Esther's dying to volunteer. Leia, what are we talking about here?
There's like a protein that like becomes poisonous to like the neurons.
Yeah. And then this plaque builds up or something like that?
Yeah, they overcrowd. And like slowly like the brain shrinks.
Yeah, and is this a fact or is this a theory? Hypothesis, or has it been borne out?
I think it's a fact.
Sarah, do you know?
I'm pretty sure it's a fact, and I was actually reading medical studies on finding a way to like make the plaque stagnant where it won't grow as much. What was it?
That'd be awesome, right?
Something to do with diabetes,
Really?
insulin, or something. I need to double check because I'm not going to say for sure.
Yeah, that'd be fascinating, right? That'd be amazing research to find out what you can do to either stop
Yeah.
it or reverse it.
No. I think it's just to make it not
Yeah.
continue. I think they were calling it like the type 3 diabetes. I'm not sure because I remember saying like type 3, that's weird. I have to double check, but I remember reading that article and I thought it was really interesting.
Okay, neat. Yeah, so it's important to understand how Alzheimer's changes the brain. You understand it's a brain disease. And that is certainly something that when we're talking about Alzheimer's, you definitely want to have at least that level of understanding, okay? The next video I want to show you, the next two videos I want to show you are related to caregivers. And it's not just about forgetting, but the first one here is about agitation and anxiety. If you know this, by the way, like about your grandparents, really important, okay?
My mom's become resistant to my help, and she's now hard to handle. She hasn't been able to manage her basic day-to-day needs without my help, but she believes she doesn't have any problems and doesn't need help. She's easily agitated and gets upset when I try to get her dressed. I'm just frustrated, and I don't know what to do. Mom, where are you? Mom, we're gonna be late for your doctor's appointment. Are you seriously planning on wearing that? It's 80 degrees outside, Mom. Okay, look, let's wear this instead. We don't have time, okay? Let's hurry. Mom, God, what is wrong with you?
Oh, leave me alone. I can do it.
No, Mom, let me, gosh.
Leave
let
me
help you.
alone.
I can help you, Mom.
I don't need your help.
Obviously, this is a dramatization, I would hope, right? But you notice how she's a little aggressive, the caregiver. Why do you think that is the case? And that's, by the way, very believable. I don't think it's like overly done. Why do you think she's a little over aggressive here? I think she's being a little too aggressive. What do you think?
She's just frustrated. She doesn't understand what's going through her head.
I mean, she's tired. She's tired of being the kid, is my guess. I mean, I'm not disagreeing, Sarah. I think maybe another shot, but I think she's tired of like, it's almost she's expecting it to go bad, and she's already worked herself up over it. So she's not calm and relaxed, right? Going in, that might make a difference. So in a way, she initiates this uncomfortable interaction, I think. Let's see.
Leave me alone. Get out! Do this to me.
Agitation and anxiety can manifest as
By the way, I totally have anxiety just watching that clip. Anyone here can relate to that? It like totally got to my stomach right away. That was weird. Okay, let's see.
difficulty sitting still, pacing, fidgeting, acting irritable, afraid, nervous, worried, or just being resistive to help from others. The behaviors are often triggered by a feeling of loss of control, misperceiving situations or actions as threats, unmet needs, inability to communicate clearly, and frustration with tasks or interactions with family and caregivers. Changes in a usual routine can also cause agitation and anxiety. People with dementia, for example, may have impaired insight towards their own cognition and ability level due to their disease. For this reason, they have a hard time understanding their limitations about what they can and cannot do. They may not realize that they need help, as they do not see themselves as having problems. This can lead to agitation when someone tries to help them. How one approaches a person with dementia makes a difference. If you feel angry, impatient, or frustrated, or if you rush someone or seem irritable, they can sense your mood and react with apprehension,
That's totally true.
resistance, anxiety, and agitation. Agitation can then escalate to inappropriate behaviors, such as hitting or biting. It is very important to remember that persons with dementia react and respond to how a caregiver approaches them. How you speak to them is key.
Okay. So we got a little more.
Good morning, Mom. How you feeling?
I'm all right.
Okay, what would you like to wear today? You look good in the green or the blue? Which color do you want to try
I don't
today?
need your help. I can do it myself.
I'm sorry that I made you feel that way, okay? You're doing very, very well, and I'm just here to help in case you need me. I know you can do it yourself very well. I love you so much, and I just want to be here when you need me. Can I stay with you? We can do this together? Okay, good. So we are going to go to the doctor's, and then we can go get some ice cream. How does that sound?
Oh, that sounds good.
Okay, let's get you dressed, Mom. Let's lose this. We want you to be comfortable after all. Let's see. Yeah, I think this is gonna look good. Perfect.
Here are a few tips on how to respond to agitation and anxiety.
By the way, always helpful, not just for this, okay?
Allow ample time to complete tasks and don't rush your loved one. Use a gentle tone of voice, but do not be condescending. Try to keep your body language positive and use calming gestures and a gentle touch. Don't be demanding or bark orders at your loved one. Instead, provide reassurance. Speak in calming tones and phrases. Let the individual know you're there for support. Try to schedule activities around your loved one's natural routines. For instance, if your loved one is a late riser, plan doctor's appointments for the afternoon. Simplify the environment to reduce frustration or confusion. For example, Thin out the closet so that it is easier for your loved one to see inside. Have fewer clothing options to choose from, and clothes that are easy to put on.
Okay, those are all good ideas, right? I want to show you one more. Oops. This one is also from UCLA. They've got a nice series here. Let's take a look in a moment. How many of you could relate, by the way, to that last video, even if you don't have a Alzheimer's patient to take care of? Just curious. Like,
Yeah, my great grandfather has Alzheimer's. I just visited him, and I think it's really true, because also what happens is, like, as their brain starts, like, they start getting confused, they pick up more and more on just general tones and general vibes than like actually what you're saying or doing. So if you're giving them like a calming, like if you just like are smiling and giving them like a calming, feeling, then that's what they'll react to, as opposed to what you're actually saying.
mm-hmm. It's almost like a baby, I don't want to say we're pets, but
Can't really talk about anything like really deep. You just kind of say like, "Oh, you look so beautiful today," and just kind of things that make them feel good. Can't really be like, "The worst day ever," like in college, whatever. They like really get lost. They're just lost in your conversation. They have no idea.
There is something about Alzheimer's patients that we haven't touched on here, but that especially advanced, really advanced, like Sarah mentioned earlier, they stop eating, they stop caring for themselves, they stop whatever. But in terms of their own, like the way their mind works and stuff, there is a phenomenon in which Alzheimer's patients will become they'll lose their filter and they'll say things that are totally inappropriate. I remember my grandfather, Alav Shalom, it was the beginning of his dementia. He made some comments. I was like, whoa, where did those come from? Those are not so appropriate. Sarah, what'd you say?
My grandmother too. When my grandfather too. When my grandfather passed away, she kind of just like, it was just a completely opposite pole. It just happened so quickly. And like during the Shiva, she like had a cousin that was like a little bit heavier, and she was like very into her health, like yoga every day, And she's like, you're like, why are you eating that? My grandmother. My grandmother, she did yoga for like 82.
Wow. Okay.
And like, she's like, why are you eating that? And then like, I don't know, she was just saying like very interesting things, and like when it's your close one, you don't really realize like the change, because you're just kind of like making like, oh no, she's fine, because she was like driving, going to yoga, like you don't notice these things right away, and then all of a sudden there's just like this huge decline, and like they can't do anything for themselves. They can't, like they're not the same person. Like before I went to seminary and after I went to seminary, it's just a different person. I like can't even say anything to my grandmother without like, because she just gets confused. Like she doesn't even know like a picture is herself. She thinks she's like 60. She literally thinks she's like this young person, and she'll be like, why didn't you tell me this person died? Or I'm trying to find my mother, or like things that are just like, she doesn't know that her kids died or that her husband died. She just doesn't, she's like very lost in like limbo between times. So it's very like, if you ever meet someone like that, they can't follow on. Even if you're having a conversation, they won't remember the conversation. They won't remember a lot of.
Yeah, the joke was you can give a gift over many, many times to them. You give them a gift, they're so happy about it, and then you give them the same. You give them the same gift again. But obviously, that's
like if you say positive things and you constantly reinforce positive things, and you're constantly like reminding them like who you are and everything, they do remember. Like my grandfather had a stroke, okay, like everything was whatever, and he remembered me because I made it a point to go to him and be with him. And if you really pay attention, first of all, they're very, even though they're losing it, still very lovely anyway.
Yeah, for sure. There's an extreme example. There was someone by the name of Rabbi Henkin. Rabbi Henkin was like the other gadol in New York with Rav Moshe Feinstein at the time, in terms of like halachic issues that came up. And Rav Henkin was famous for obviously being for a number of reasons, but one of the things that he felt very strongly about, one of the issues that he felt very strongly about had to do with an Eruv. Okay? Had to do with an Eruv in a particular city. And I don't even remember which side he held. It was Asr or Butter, okay? And the other issue that he felt very strongly about was that you should not eat before Tekiyah Shofar. There's a whole halachic discussion. Are you allowed to eat before Tekiyah Shofar? And Reb Aaron Cutler, who was obviously the Rosh Hashiva in Lakewood, so he had a machlokes about these two issues with Rav Henkin. They both had places where they were coming from. Neither one was wrong, right? They were both right from their own perspective. And when Rav Henkin got sick and he had Alzheimer's late in his life, he just kept repeating over to himself in Yiddish, like, Erev is not kosher and you can't eat before Tekiyos. Just like with the anger and the animosity maybe like in his voice. But like that was like the base part of him, that expressed itself. As opposed to you go to a nursing home and you go to Alzheimer's unit, people are cursing and people are being inappropriate and who knows what's going on, right? When you have a gadol b'Yisrael who's inappropriate, it means that they start saying what's on their mind, and this is what's on the deepest part of his mind. It's really fascinating, a fascinating share, if you will. Okay, let's watch one last video, please. And this one is. Hold on, I gotta pull it up here.
It was like that for him
Pardon me?
because I'm saying I think that I said it was interesting that it was like that for him because there are some things that are really important to people and you can tell by the end of their life. Like my grandfather, he was still learning and davening, but he wasn't having conversations with anyone, just learning,
Right.
like fluent learning, no problem.
Right.
He just does.
Yeah, my wife's grandfather actually was like that too. Like if you started a pasuk, he would finish it.
Yeah.
If he started a chazal, he would finish it, and he knew it all by heart.
Yeah.
But if you asked him like who his grandson was, he had no clue, because there's a difference between like short-term memory, long-term memory. And by short-term, even like 30 years. Rav Ruderman, who was Rosh Hashiva of Ner Yisrael, he's actually I've got a picture of him right over here. You probably can't see that clearly, but let's see. A friend of mine actually did this. This is a print, but it's he signed it somewhere. He used to have the signature on it. I wonder what happened to it. It's probably covered up by the frame. Anyway, so a friend of mine did that. It's a charcoal. And Rav Ruderman at the end of his life was depressed that he was forgetting things. So my uncle, who was one of his major Talmidim, Rabbi Moshe Brown, who himself is a world-class Talmid Chacham, so my uncle was like discussing things with him, and he was quoting Rishonim right, left, and center from all over the place. And he says, I don't understand. You know, like the Rashba, this obscure Rashba in an obscure place, you know it by heart, and you tell me you're forgetting. Like I don't understand. He says, I forget the chidushim I made up yesterday. He said, but to forget a Rashba, how do you think I'd forget my middle name? Okay, I couldn't forget my name, right? But forget the chidushim I made up yesterday. So it's obviously there's going to be different levels and of it. I actually have two more videos. We'll see what we have time for. Here is the first one. This one is related to caregiving and a refusal to bathe from UCLA. It's kind of similar to the anxiety one in the sense of probably like it's meant for caregivers, but let's take a look at it just so we have an appreciation of it.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me
It's been
alone.
a
Don't
week.
touch me.
Come on. It's been a week since your last one. You need one. Please get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. Oh, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Mm-hmm.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible.
Really amazing how like working with kids is so similar. You know, same kinds of tips. Let them know what you're going to do. Talk them through it. Use language that's not threatening. Am I right, Tehila?
I'm thinking the same thing. Like as I'm watching the show.
It's like the same kinds of techniques. Okay, I want to show you one last video. And I'm really just showing you these videos just to give you like a perspective on like, you know, what's involved here. I think it's not how I usually teach, but I think when it comes to this kind of stuff, Einu roed re'iyah lishmiya, as they say. Einu dome re'iyah lishmiya, I should say. All right, this last video is actually, no, it's too long. I'll put it in the chat in case anybody wants to watch it. It's called Living with Alzheimer's and Dementia. It's only an hour long. And I'm sure it's fascinating. And those of you that want to watch it, you might, or have parents, grandparents, great-grandparents with Alzheimer's, it might be worthwhile. But I'm definitely not going to do that with you. I want to take a look with you at the quiz question. Based on chapter 17, 18, interesting, because I only taught you 17. What do you think is the biggest decline in late adulthood? What do you think is the most helpful aspect in terms of maintaining abilities? I think that we'll probably push off this question. What do you guys think? Should we push
Are you
off?
saying no homework this week?
I'm just, hold on a second, let me just see. Let me just look, end of
No
life.
homework?
Okay, give me a second. I just want to see if we, so according to this, we have 1 week left, right? Have you guys, I got actually a final schedule. Just hang on with me here for a second, I'll pause the recording.